Thank you for watching, and be sure to talk to your healthcare provider if you have any questions or concerns about your medications and any health conditions you may have. Disclaimer: the information presented in this video is for educational and informational purposes only. It is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified healthcare provider with any questions you may have regarding a medical condition. Never disregard professional medical advice or delay in seeking it because of something you hear or see in this video. Introduction. MYDRIASIS, the dilation of the pupil of the eye, is a fascinating physiological response that plays a critical role in visual perception and medical diagnostics. The intricate interplay of the autonomic nervous system and ocular structures regulates the pupil size, influencing the amount of light entering the eye and affecting overall visual function. This video delves into the mechanisms, implications, and clinical significance of mydriasis, shedding light on its multifaceted nature. Mechanisms of mydriasis. The pupil, the dark circular opening in the center of the iris, regulates the amount of light that enters the eye. Two sets of smooth muscles control its size: the sphincter pupillae, responsible for constriction, miosis, and the dilator pupillae, responsible for dilation, mydriasis. The autonomic nervous system governs these muscles, with the parasympathetic and sympathetic branches having opposing effects. 1. Parasympathetic control. The parasympathetic nervous system, via the oculomotor nerve, cranial nerve 3, stimulates the sphincter pupillae to contract. Acetylcholine is the neurotransmitter responsible for this effect. When light intensity increases, parasympathetic activation leads to miosis, reducing the pupil size to limit the amount of light entering the eye. 2. Sympathetic control. The sympathetic nervous system, through the dilator pupillae, promotes mydriasis. Norepinephrine is the primary neurotransmitter in this process. When exposed to low light conditions or during states of heightened arousal, sympathetic activation leads to pupil dilation, facilitating better vision in dim environments. Implications of mydriasis. Mydriasis serves essential functions in the visual system, impacting various aspects of vision and ocular health. 1. Adaptation to light conditions. Mydriasis allows the eye to adapt quickly to changing light conditions. In low-light situations, the dilated pupil permits more light to enter, enhancing visual sensitivity. Conversely, in bright conditions, a constricted pupil prevents overexposure of the retina to excessive light. 2. Depth of field and accommodation. Pupil size influences depth of field and the eye's ability to focus on objects at varying distances. A smaller pupil increases depth of field, making it easier to focus on objects at different distances. Mydriasis, with its wider aperture, may reduce depth of field but is advantageous for viewing distant objects. Clinical significance. The study of mydriasis holds great significance in both medical diagnostics and the understanding of neurological and ophthalmic conditions. 1. Diagnosis and monitoring. Medical professionals use mydriasis for diagnostic purposes. Administering drugs such as atropine or tropicamide induces temporary mydriasis, enabling a clearer view of the retina and optic nerve during eye examinations. Abnormal pupil responses may indicate neurological disorders or ocular pathologies. 2. Neurological and ophthalmic conditions. Mydriasis abnormalities can be indicative of neurological disorders such as Horner's syndrome or oculomotor nerve dysfunction. It can also be a symptom of various ocular conditions, including uveitis and glaucoma. 3. Pharmacological applications. Mydriatic agents find application in treating conditions like uveitis, where pupil dilation can alleviate pain and facilitate treatment. Additionally, mydriatics are used to manage some forms of refractive error and in intraocular surgeries. Conclusion. Mydriasis, the intricate interplay between the autonomic nervous system and ocular structures, serves critical roles in visual adaptation, depth perception, and diagnostic medicine. Understanding the mechanisms, implications, and clinical significance of mydriasis not only enhances our comprehension of ocular physiology but also underscores its importance in various medical contexts. As technology and research progress, the study of mydriasis continues to unveil new insights into vision, neural function, and the intricate connections between the eye and the nervous system.